tray, in the specimen tray, in the examination hall. Now the kidney is lying, the liver is lying, and also the spleen is lying there. And in one tray it will be the intestine, the pancreas and all this. Another tray will be brain or other. Now why? Because when you go and see that specimen, you will see that size is different. It's okay. Even large kidneys are there, but this is a small, too small, just a medium-sized kidney. Okay. Now, the competency-based undergraduate curriculum. Identify the lymphoid tissue under the microscope and describe microanatomy of lymph node, spleen, thymus, tonsils, and correlates the structures with the function. Now, this is the spleen. Today, we will be discussing the spleen. Now, what is the lymphatic system? Provides protection to the individual by imparting immunity. It is the lymphoid tissue that provides the immunity of a person. Now, the immunity is the ability of the organism to resist a particular infection or toxic substance with the help of antibodies or activated white blood cells. There are two types of immunity, innate and acquired immunity. Innate or native immunity is present at birth. Innate immunity provides non-specific protection against all types of infection. Acquired or adaptive immunity is acquired by the individual throughout life. Now that can be an MCQ question also. What is innate? Innate immunity रहता था. So you accordingly you answer. Now acquired immunity is of two types. This is question in Viva. Acute immunity is required by an individual on exposure to antigenic agents, toxins or microorganisms during exposure. Immune cells get activated and impart acquired immunity. Now, passive immunity, it is acquired by the individual by transfer of ready-made antibodies, immunoglobulin injections. This is the immunoglobulin acquired, the immunoglobulin injection. Now this you will be reading in your theory. Lymphatic tissue, list of primary and secondary lymphoid organs. List of primary and secondary lymphoid organs. Lymphatic tissue is a specialized form of connective tissue. Lymphoid tissue is a specialized form of connective tissue. Now, consists of immune cells, lymphocytes and plasma cells, meshwork of reticular fibers and cells. Now, lymphoid tissue identifies foreign antigens and dead and old cells of the body and removes them by phagocytosis or by producing antibodies. Lymphoid organs are classified as primary and secondary lymphoid organs. Now, primary lymphoid organs and secondary lymphoid organs. Now, primary lymphoid organs, these are also called central lymphoid organs. These organs produce immature lymphocytes from stem cells or immature cells, for example, thymus and bone marrow. Now, this is the primary lymphoid organs are the thymus and the bone marrow. Now, lymphoid organs. Now, primary lymphoid organs convert stem cells to immunocompetent immature cells, thymus and bone marrow. Now, secondary lymphoid organs, site of activation and proliferation of immunocompetent cells, example, spleen, lymph nodes, tonsils, appendix. Now, secondary lymphoid organs, these organs provide exposure to foreign antigens and convert immature lymphocytes into active lymphocytes. For example, spleen, lymph nodes, tonsils, appendix, and Peyer's patches. Histologically, lymphoid tissues are grouped as follows: diffused lymphoid tissue and dense lymphoid tissue. Now, diffused lymphoid tissue. Now, lymphocytes are distributed throughout mucosa of gastrointestinal tract, respiratory, urinary, and reproductive tracts. This type of lymphoid tissue is called diffused lymphoid tissue. Now, diffused lymphoid tissue is the mucosa of the gastrointestinal tract, respiratory tract, urinary tract, and reproductive tract. The mucosa. This type of lymphoid tissue is called diffused lymphoid tissue. And and this lymphoid tissue is associated with mucosa. It is also called mucosa associated lymphoid tissue. Mucosa malt, M-A-L-T, malt. M-A-L-T, malt. This is the mucosa associated lymphoid tissue. Ileum is the most common site of malt, knit. Now, it protects and provides immunity against microorganisms coming in contact with the mucosa. Diffused lymphoid tissue is not enclosed within the capsule identification feature. This is the diffuse. It does not have a capsule. It does not have a capsule. Some authors consider malt as a dense lymphoid tissue. Now, dense lymphoid tissue is enclosed by well-defined capsule. Now, identification features. This includes discrete lymphoid organs such as lymph nodes. This is a feature of the lymph nodes, spleen, thymus, and tonsils. Now, they have a central round nucleus and thin rim of cytoplasm. Nucleus is densely stained, heterochromatic identification feature. Size small lymphocytes 7 to nanomicrons and large lymphocytes 40 to 20 microns. Histologically, lymphocytes cannot be differentiated into subtypes. This cannot be differentiated. Based on the presence of specific CD molecules, lymphocytes are grouped into three types: T lymphocytes, B lymphocytes, and natural killer cells, NK cells. Now, this is a question in MCQ. The T lymphocytes and B lymphocytes and natural MCQ and natural killer cells, NK cells. All lymphocytes originate from bone marrow. T lymphocytes also originate from bone marrow. Now, these T lymphocytes. Now, amongst all these three, now today we will be discussing the spleen. The rest is that you have to know even a lymph node can be describe the lymph node. Then you have to describe the anatomic and also the other, what are the lymph, the cellular components and function of the lymph nodes. Okay. Now today, spleen is the largest lymphoid organ. Spleen filters blood and helps to remove old RBCs and maintain immunity. Spleen is located in upper part of the abdomen. It has a lateral diaphragmatic surface and medial visceral surface. Visceral surface has a hilum. Through the hilum, splenic vessels enter the spleen. Now this will be, we will be seeing it in the specimen. That's hilum. Even it has a feature like the kidney. And the kidney has a hilum. So I've kept two organs side by side. You see it, and the histological sections. Now, gross section of spleen. A slice of fresh spleen specimen shows white pulp and red pulp. White pulp is grayish white areas that are scattered throughout substance of the spleen. Red pulp surrounds the white pulp. Now, microscopically, it is observed that white pulp shows aggregation of lymphocytes and looks basophilic, blue, on H&E stain. Red pulp shows presence of many blood-filled RBC sinusoids. You will be seeing it there. Yeah. RBC sinusoids and looks basophilic, blue on aggregation of lymphocytes looks basophilic, blue on H&E stain. And red pulp shows presence of many blood vessels, RBC sinusoids. Now, histologically, spleen shows capsule, white pulp, red pulp. Biba identification features. Histologically, spleen shows capsule, white pulp, red pulp. Now, when you say 5 slides are given, naturally there can be one slide can be kidney, and the 4th slide can be your spleen. And so you have to differentiate, identify. In a kidney, you will get glomerulus, then ascending tubules, Bowman's capsule. These are the main features which gives you an identification or differentiates from the spleen. What is spleen? Now, spleen does not have lymphatics. Okay. Now, see, these are please note for Viva and identification features, Viva and MCQ. Now these are the two questions. Capsule and trabeculae. Spleen is covered by dense connective tissue capsule. Trabeculae arises from the capsule and enters into the parenchyma of the spleen. Trabeculae divides repeatedly. Reticular cells and reticular fibers form the meshwork in spleen. Connective tissue of spleen also contains myofibroblasts and contract the capsule and trabeculae and helps to discharge stored blood from the spleen. This is a question of Viva. Okay, white pulp. Based on the color of the fresh section, parenchyma of spleen has two regions, white pulp and red pulp. White pulp consists of lymphoid tissue. Now, what the white pulp consists of? Lymphoid tissue. Trabecular branches of splenic artery gives rise to central arterioles that enters into the parenchyma of spleen. White pulp forms sheets of lymphoid tissue surrounding central arterioles. These are called periarterial lymphatics, PALs. PALs has a cylindrical masses that run along the long axis of the central artery. In cross section, PALs look like a mass of lymphoid tissue surrounding a central artery. Identification features. See the capsule and trabeculae, the parenchyma, white pulp and red pulp, white pulp, darkly stained basophilic central arteriole surrounded by periarterial lymphatics made up of T cells, splenic nodules, Malpighian corpuscles made of beta cells have germinal center and centric arteriole. Now red pulp lightly stained, more eosinophilic. This is basophilic. White pulp is basophilic. Red pulp is more eosinophilic. Cords of Billroth made up of RBCs, lymphocytes, macrophages and plasma cells. Splenic sinusoids lined by elongated endothelial cells filled with RBCs. Marginal zone lies between the white and the red pulp, contains numerous antigen presenting cells. Now this is the picture, the capsule and red pulp. This is the red pulp, this is the white pulp. Okay, trabeculae. You can see the arteries here in cross eccentric arterioles, the splenic cords and lymphatic follicles, germinal center. Now in higher magnification, this is the photomicrograph, that is the illustration. Now you can see the red pulp and white pulp here. Red pulp is here. See the eccentric arteriole in the lymphatic follicles, red pulp, splenic cords and white pulp. Each thing and the gross specimen. It is not question of getting marks or something. Of course, that is the prime important for this coming 3 months. ভুলে যেতে হবে, সব কিছু ভুলে যেতে হবে। খাওয়া দাওয়া স্নান করা যেমন 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 হবে সেরকম করতে হবে। কিন্তু আমি তাহলে ভয়ঙ্কর লাগছে, আমারই ভয় পেয়ে যাচ্ছে। আমি স্টেজে উঠছি, আমি ভয় পাচ্ছি, কিন্তু তোমরা মানে বদারলেস। এটা আমার দুর্ভাগ্য। আমি জানি না আদার টিচারদের দুর্ভাগ্য কিনা, হয়তো তো আর নোটিস করলেও পাত্তা দেয় না। তোমরা বলছি, তোমরা দেখছো না, বেরিয়ে চলে যাচ্ছ। আরে ভাই, তুমি এটাকে ফিল করো, ধরো। আর ডাক্তার হয়েছো, তোমার হাতে পটি করে দেবে, গ্লাভস ফেটে গেল। তুমি একটা অ্যাবসেস ওপেন করলে পুচ করে বেরিয়ে গেল, গালে মুখে লেগে গেল। ওই জিআই টিআই হবে না, এআই হবে না। একটা পাওয়ার পয়েন্ট ওপেন করছে না। এখানে যারা টেকনিশিয়ান আছে তারা বলতে পারছেন যে কেন ওপেন করছে না। একটা সিম্পল পেন ড্রাইভে পাওয়ার পয়েন্টে যদি ক্র্যাক করে যায় তাহলে সেটা দেখতে পাচ্ছে না। ডাক্তার নেই, কোথাও নেই, কিচ্ছু নেই, ক্লিনিক্যাল নলেজটাই মাস্ট। এই যে ল্যাপ্রোস্কোপি অ্যাপেন্ডিসেক্টমি, আমি 1992 আমি দেখে নিচ্ছি, আমার মনে নেই, যখন পেপারটা আমি প্রেজেন্ট করছি কিরকম আমি বলেছি, this is an incision, cosmetic incision, bandages, cosmetic incision for fecal appendicectomy, because laparoscope was not available in centers like ours. In Calcutta, only 1 or 2 people are practicing laparoscopy. One of them is my teacher, registrar Chilo, Dr. Dipankar Singh Gupta. So he used to laparoscopy to me and all this. A brilliant surgeon, brilliant student. And his father was my father's ophthalmology teacher. And in those days, but now again the medical dialogues, একটা সাইট আছে দেখুন, ওটা তোমরা ডাউনলোড করে দেখে নেবে, যে বিভিন্ন ফিচার্স নিয়ে ডিসকাস করে, এই এনএমসি ইয়ে নিয়ে ডিসকাস করছে, রুলস নিয়ে ডিসকাস করছে, বা এটা নিয়ে ডিসকাস করছে, স্টুডেন্টস এবার কি নিটে কতগুলো পিজিসি খালি আছে এইসব, সেখানে একটা মেডিকেল ডায়ালগ দেয় অ্যাপেন্ডিসেক্টমি অ্যান্ড ল্যাপ্রোস্কোপি। এবার এগুলো ধরো একটা 10 বছর 15 বছর 20 বছর কাজ হওয়ার পরে তো একটা রিভিউ হয়, আমাদের দেশে রিভিউ হয় না, আমাদের দেশে রিভিউ হয় না। কিন্তু এবার মাল্টি সেন্টার ট্রায়াল, ধরো ইউনাইটেড স্টেটস অফ আমেরিকা বা ইউরোপ, সেখানে এক একটা সেন্টারে এতগুলো ল্যাপ্রোস্কোপি অপরচুনিটি, সেই ডেটাবেসটাকে নিচ্ছে, তাতে বলছে open laparoscopy and open appendicectomy is safe, more safe. It is small incision. When you read the appendicectomy, appendix হয়ে গেছে তোমাদের, colon, appendix, cecum পড়ানো হয়ে গেছে, so the anatomy of the appendix and the position of the appendix is very easy or very complicated. একটা 2 মিনিট 3 মিনিটে একটা বার করে দিতে পারবে, আবার দেখবে যে আধ ঘন্টা 45 মিনিট খুঁজছো পাচ্ছ না, এখানে কোথায় লেগে আছে, এটা এত বড় অ্যাপেন্ডিক্স সাবসিকাল হয়ে পেছন দিকে ঢুকে আছে। তো আমার বক্তব্য হচ্ছে যে এই কম্পোনেন্টে তোমরা তো আর হিস্টোলজি করতে আসবে না, এরপরে প্যাথোলজি করবে। ইফ ইউ নো হোয়াট ইজ গ্রস অ্যান্ড কোরিলেট উইথ ইয়ার হিস্টোলজি, এইটাই হায়ার ম্যাগনিফিকেশনে দেখবে। তাহলে আমি কেন এই দুটো মোর অর লেস সেম টাইপ অফ ফিল ইজ সেম। ওকে, ইট হ্যাজ আন হাইলাম, কোথায় ছেড়ে গেছে, আমি এটা দেখাই, এর একটা ক্যাপসুল আছে, এই যে ক্যাপসুল, এটা হাইলাম। The splenic vessels go in. Then the tail of the pancreas is related here. Spleen পড়া হয়ে গেছে, হ্যাঁ পড়িয়ে দিয়েছে, demonstration হয়ে গেছে, tail of the pancreas is there. So when you are doing a splenectomy, তখন you have to be very careful for the tail of the pancreas, and then you do আজকে যেটা বললাম একটা traumatic spleen, then you do clamp and splenectomy, total splenectomy. এবার এক এক করে দেখতে লাগো, যাদের ইচ্ছে হবে ফিল করো, হ্যাঁ, যে কাবাবটা ঠিক তৈরি হয়েছে কিনা, বিরিয়ানি মাটনটা তৈরি হয়েছে কিনা, দেখে নাও, মজা করে পড়ো, হ্যাঁ।